Hello everyone, today's drug is going to be Sumatriptan or Imitrex. Let's go talk about patient education. So Sumatriptan is used to treat migraine headaches and can also be used to treat cluster headaches. This drug comes in many different forms. It comes in a tablet form, injection, a nasal spray, and nasal powder. Generally, if your headache does not get any better after the first dose, you may take one more dose if your doctor has told you to do so. Be sure to know how many hours to wait before taking another dose, though. And for tablets, you may take it with or without food. And for injections, it's given under the skin as early as it can be after the attack started. And your provider will be teaching you how to give the shot yourself. And then for nasal spray and powder, it can be used as early as you can after an attack started. Some common side effects that you may experience with sumatriptan includes feeling dizzy, sleepy, tired, or weak. You might feel a little flushed, feeling a little warm, upset stomach, and throwing up. And this is a rare but a serious side effect that you need to call your doctor right away if you start seeing any signs of high blood pressure, like very bad headache or dizziness, any loss of eyesight. If you start noticing blue or gray color of skin, lips, nail beds, fingers, or toes, and if you're starting to experience uncontrolled diarrhea or really bad constipation. Now, for the background, sumatriptan is in a class of medications called selective serotonin receptor agonists. So, serotonin has a central role in the pathophysiology of a migraine. Its metabolism is abnormal in patients with migraines, and anti-migraines Anti-migraine drugs share the ability to activate 5-hydroxytryptamine receptors. So the mechanism of action of 5-HT1B/1D receptor agonists, or triptans, have three distinct modes of action, all of which may be additive in their anti-migraine effect. These effects include vasoconstriction of painfully distended intracranial extracerebral vessels by a direct effect on avascular smooth muscle. It inhibits the release of vasoactive neuropeptides by trigeminal terminals, innervating the intracranial vessels and the dura mater, and also the inhibition of nociceptive neurotransmission within the trigeminal cervical complex in the brainstem and upper spinal cord. So for the indication for this medication, we have acute cluster headaches, which can be used as a monotherapy or combination with 100% oxygen. It can be administered in different forms. So subcutaneously, which is the preferred route, you can administer 6 milligrams once, and then a lower dose of 3 milligrams may be effective in select patients. And if initial dose was effective, but headache recurs, you may repeat a dose after 1 hour. And then for intranasal, which is an alternative route, you may administer 20 milligrams once in single nostril, contralateral to the side of the headache. And then we can also use it for cyclic vomiting syndrome, which is migraine associated, and it's used as an abortive therapy. You may administer sumatriptan during prodrome or shortly after vomiting begins. It's usually within 30 to 45 minutes, and it may be used alone for relatively mild or infrequent episodes. And then you may also administer it intranasally for 20 milligrams, and then you may repeat after 2 hours in patients with no or partial response. you would have a maximum of 6 doses per week. And then subcutaneously, you may administer 6 milligrams and then may repeat after 1 hour in patients with no or partial response. And then you have a maximum of 6 doses per week as well. And then we also use it for migraine, for moderate to severe as an acute treatment. So administration early in the course, you may administer early in the course of a migraine attack or at the first sign of pain, and then it may improve response to treatment. So you may take it orally for 50 to 100 milligrams as a single dose, and then if symptoms persist or return, you may repeat the dose after 2 hours. You have a maximum dose of 100 milligrams per dose and then 200 milligrams per 24 hours. And then you may also administer it subcutaneously, usually with 6 milligrams once, and then if symptoms persist or return, you may repeat the dose after 1 hour. And then if 6 milligrams was not tolerated, subsequent doses of 1 to 5 milligrams may provide sufficient relief with better tolerability. But you do have a max dose of 600 milligrams per dose and then 12 milligrams per 24 hours. Now for intranasal administration, there's different forms that you may use. We have a solution, which you usually administer 20 milligrams as a single dose in one nostril. And then if symptoms persist or return, you may repeat after 2 hours. And then you have a maximum dose of 40 milligrams per 24 hours. And then we also have a powder form, which is breath activated. You administer 22 milligrams as a single dose, and then using a specific product device, you also may give as one 11 milligram capsule insufflated in each nostril. And then if symptoms persist or return, you may repeat dose after 2 hours. And then we also have a spray, which is a 10 milligram as a single dose in one nostril. And then if symptoms persist or return, you may repeat dose after 1 hour. And now we're going to go ahead and talk about adverse events. So as mentioned, common adverse events for sumatriptan includes dizziness, feeling hot, tingling sensation, any chest discomfort, nausea, vomiting, and then injection site reactions if you're using injections. And then just some warnings that use some caution for older adults, since make sure to perform a cardiovascular evaluation prior to initiation of therapy in older adults, especially patients with CV risk factors such as diabetes, hypertension, smoking, obesity, any strong family history of coronary artery disease, and then latex allergy, as well as hepatic impairment and some seizure warnings. Now for serious adverse reactions, this drug has shown to cause cardiac arrhythmias like prolonged QT interval on ECG and subsequent ventricular arrhythmias. So onset is rapid, that occurred within 1 hour of administration. Some risk factors include any ages older than 65 years of age, and then structural heart disease, history of drug-induced torsade, congenital long QT syndrome, history of drug-induced torsades, and then any baseline QT interval prolongation. And then we also have cardiac events like coronary artery vasospasm, transient ischemia, acute myocardial infarction have been reported with triptan administration, especially in adult patients. Mechanism of action for this, it's dose related, related to the pharmacologic action of how triptans work in the body. The onset is pretty rapid. Symptoms of acute myocardial infarction develop between 10 to 180 minutes, on average 15 minutes. And then for hemorrhagic stroke, including subarachnoid hemorrhage and ischemic stroke, have been reported in adult and pediatric patients. Mechanism is dose-related, and then onset is pretty rapid, generally occurs within 24 hours. The risk factors include migraine, smoking, use of estrogen-based oral contraceptives, especially on young females. And then we also have CNS effects like CNS depression, such as dizziness or drowsiness, which may impair physical or mental abilities. It's dose related and onset is pretty rapid. So akathisia has been reported to occur within 5 to 10 minutes of sub-Q administration. And then dystonia have been reported to occur within 15 to 60 minutes of oral administration. Risk factors, they would be dose dependent. And then there's also been reports of ocular effects like transient and permanent blindness and significant partial vision loss have been reported with use in adult and pediatric patients. It's dose related, and the onset for bilateral angle closure glaucoma is rapid. It occurred within 1 week of one dose. And then we also have serotonin syndrome, which may occur particularly when used concomitantly with other serotonergic drugs. So serotonin syndrome occurs primarily through activation of 5-HT1A receptors, although 5-HT1A receptors may also play a role. Since triptans have no activity at the 5-HT2A receptors, they theoretically should not cause serotonin syndrome. And then we also have reports of peripheral ischemia and reversible cerebral vasoconstriction syndrome. Mechanism of action is unknown and onset varies. The median onset has been reported to be 2 days for ischemic colitis. And then for risk factors, it's the concurrent use of selective serotonin reuptake inhibitors. And that's everything about sumatriptan.